Hello everyone, my name is Dr. Julia Viscomi and I'm a chiropractor at Pinpoint Health in Maple. So today I'd like to talk a little bit about sciatica, and I feel like that's a term that many of us have heard before. So because it's so common, it's really important to understand what is sciatica exactly, what can cause sciatica, what does sciatica look like, how does it present, how does it feel to a person who's suffering from sciatica, and is there anything a chiropractor can do to help manage or even cure sciatica? So before I dive into any of that, I think a brief anatomy lesson would be of some value to you. I will try to keep it simple and short. So I have a spine here. Now this is my buddy. He's not in the best of shape right now. I've been playing with him quite a bit for patient education purposes, but we'll pretend he has a perfect spine. So just for a little bit of anatomy, this is a spine, this is a person looking in that direction, and you can see these little yellow things here. These little yellow things are nerve roots, and they course out from our spinal cord that you can't see right now because it's nice and safe and protected, enclosed within the bony vertebral column here of our spine. But these nerve roots come out. And in our low back, a number of these little nerve roots come together, they course together, and they create the sciatic nerve, which is the thickest, longest nerve in our body. And we have one on either side. They run down our legs. So that's the sciatic nerve. So the sciatic nerve starts from the low back and goes all the way down to our toes. Now, what can cause sciatica? So before I get into this, I have to divulge one of my biggest pet peeves in practice, and that's when someone says they have been diagnosed with sciatica. I have a problem with that, and the reason is because sciatica is a symptom. It's not a diagnosis. There are a number of different conditions that can cause sciatica, and it's really, really important to be able to uncover the underlying condition that's causing the sciatica in order to best formulate the treatment plan that will be most effective for your patient. You can have two different people present with the exact same pattern of sciatica, but they can have two completely different conditions that's causing it. And so my treatment plan for the one patient might be completely different from the treatment plan for another patient. Otherwise, I can aggravate that latter patient's condition. So what are the conditions that can cause sciatica? You can have degenerative changes in the spine, so osteoarthritis, which is arthritis due to aging, that can impinge on the sciatic nerve, causing sciatica. You can have a space-occupying lesion of sorts, so you can have a cyst or a tumor that's pinching the nerve. Pregnant women can often have sciatica. You can have a really tight muscle in the gluteal region called the piriformis. The sciatic nerve becomes a little bit more superficial just underneath the piriformis muscle. And so if you have a really tight piriformis muscle, it can impinge on that nerve and cause sciatica as well. Probably the most common cause of sciatica that we know about is a disc bulge or a disc herniation. And I say or because oftentimes bulge and herniation are used interchangeably, and they're not. They're actually different, both from an anatomical standpoint and also prognostically as well. So it is important to differentiate if a bulge if a discopathy is a bulge or a herniation. Regardless, if you have pathology in your disc, it can put pressure on that nerve and cause sciatica as well. So there are a whole bunch of different reasons why a person might have sciatica. So how does sciatica look? What does it look like? You can feel sciatica anywhere from the small of your low back all the way down to your toes or to the top of your foot or the bottom or the side of your foot. So down your glutes, down your leg, all the way to your toes. It can be that entire course. It can be patchy in some areas. It could change from day to day, hour to hour. It can look like a whole bunch of different things, but in terms of characterizing the sensation, it could be anything from numbness or tingling to ants crawling up your skin. to a really shooting pain or a lightning bolt, or I've had it described as feeling like an elastic band is being pulled. So it could be a bunch of different things. And typically a person will feel it. They'll be able to trace a path with their fingers. They'll say, you know, it runs down my bum, down the back of my leg, maybe down the side of the lower leg, and the side of the foot. So that's sciatica. Now, it's also important to note that in people who have had sciatica for a very long time, or maybe they have a particularly severe bout of sciatica, you can also get some changes in your motor function as well. The sciatic nerve supplies some of the muscles in our leg, and so if you've had sciatica for a while, you can get denervation of these muscles, and so people will have a tough time either with dorsiflexion, so lifting their foot up to the sky, or in plantar flexion as well. They'll have difficulties walking, and objectively speaking, we might notice a change in girth. If you compare the good leg to the bad leg, the muscle in the bad leg will start to atrophy, so we can use a tape measure and see that the muscle is actually a little bit smaller now. If I take a person's reflexes, we might see some diminished reflexes in the affected leg. So there are a number of different things that can happen in people with sciatica. It's not pleasant. So all that being said, is there anything a chiropractor can do for people with sciatica? And you're probably guessing, if I, a chiropractor, am talking about sciatica, then yes, there is quite a bit we can do. Just a little bit of a disclaimer, chiropractors cannot treat all cases of sciatica. There are some cases that are too severe for conservative care, conservative meaning a non-surgical, non-medical approach. And there have been times where I've said to a patient, in my initial examination, you know what, I think you're a good candidate for surgery. You should consult with an orthopedic surgeon. Or if a patient has been under my care for a reasonable length of time, and they've tried a reasonable course of conservative treatment, and we're just not getting the results that we would expect to see or that we'd hope to see, then I might refer them out as well. But for the majority of the population who have sciatica due to a mechanical cause, then there are some things that we can do for them, and two of those things is something called nerve flossing or nerve gliding. The two terms are synonymous, and McKenzie exercises. So in my next video, I will demonstrate how to do both. They're very, very simple to do. They don't require any equipment, and they do offer a lot of relief. So thanks very much for watching. Stay tuned, and I will show you how to do these things at home.